Claire was in so much pain that she could do nothing but scream at the top of her lungs.
I was just so scared that I was going to have to stay in the hospital forever.
Beth and I were not sure where to go at all. We were completely lost.
I would literally jump out of my skin. The pain would send kind of shock waves through my body.
It was really difficult to grasp the idea that my mom was hurting for so long.
I was really concerned. She couldn't seem to get away from the pain.
I didn't want it to win.
Next, two medical mysteries that defied the experts. From the day she was born, the mysterious birthmark on Claire Manty's face has been randomly changing color. But no one could have ever imagined that the tiny spot is actually a sign that will change the little girl's life forever.
The toughest part was realizing that we may be dealing with something life-threatening.
Then, Sue Ingraham's seemingly perfect life is turned completely upside down by a relentless series of attacks that push her to the brink.
I didn't know what the future was going to hold. I just didn't know how I was going to deal with all of this.
Okay, Alan, so what we're going to do is get ready for scrubbing first. So tell us what you need to do to get ready to be able to scrub.
Okay, so what you need to do, as I've already done, is put my eye protection on. I'm opening my gown now, ensuring that I don't touch any of the...
You're just touching the very, very edges of the...
My gloves. Now I'm putting my gloves above my gown, so I don't then touch them later on.
Oh, okay. And then opening that packet, you just...
I'm putting my mask on, so got to make sure that's very comfortable because it might be on there for a few hours. Tie it at the top, bottom ties.
When Beth and Ryan Manty first laid eyes on each other in a Green Bay, Wisconsin pizza parlor, it was as close as it gets to love at first sight.
It was an unbelievable moment. I remember it like it was yesterday.
Still, little did either of them know that just a few years later, they'd be tying the knot.
We got married in June of 1990, and we're looking forward to starting a family.
They tried for nearly a decade with no success, until one day in the spring of 1997, their luck suddenly changed.
That morning was no different than any other than I knew it the second she walked out of the bedroom and I saw it in her face that she was pregnant. It was the greatest morning ever.
Brian and I were very excited, but nervous.
Beth's pregnancy goes off without a hitch until 2 weeks before the due date when her water suddenly breaks.
It was late at night. We gathered our stuff and raced to the hospital thinking that it was going to happen any moment.
At the hospital, Beth is hustled into a birthing room. But just when it seems she's about to have the baby, her labor stalls.
The contractions were getting further apart instead of closer together, so the baby would slip back up.
The doctor soon determines that the baby's head is lodged behind Beth's pelvic bone. Using a vacuum extractor, he carefully applies pressure to pull the baby out.
It was scary. It seemed to take a really long time.
Finally, 12 hours after arriving at the hospital, Beth gives birth to a baby girl.
The biggest thing I remember is telling Beth that it was a girl. Our family had never had a girl.
Claire Rose Manty weighs in at a healthy 7 pounds, 14 ounces. But right away, the parents can tell that something is very wrong.
The left side of her face was really swollen up.
There was bruising around the left ear, the cheek on the face, underneath her jawline, and what appeared to be more purplish area that was possibly a birthmark. The doctor reassured us that the bruising should resolve along with the swelling within the first couple weeks of life, and the birthmark would get lighter as she got older.
So much better when all that swelling goes down.
3 days later, Beth is discharged and the new parents take their daughter home. Over the next 4 months, Claire's bruises slowly heal and disappear, but the purplish birthmark with its strange bumpy texture remains as clear as the day she was born.
I wasn't so much worried about the mark on the side of her face. I guess I was just more happy that she was healthy and seemed to have 10 fingers, 10 toes.
But when Claire is about 6 months old, Beth and Ryan can't help but notice that something seems to be bothering their little girl.
She would reach and pull and tug at her ear. We could tell that she was probably in some ear pain.
Alarmed, the Manties take Claire in to see their family physician.
And that's when they started to notice an infection in her ear and put her on antibiotics. It would be 2 or 3 days before the antibiotic was completely working for her and she was feeling better.
But it's not long before Claire starts to show signs of pain yet again.
I was mentioning to the doctors that she was having what seemed like these pain episodes.
They always said that she had a sinus infection or an ear infection or just a cold.
Over the next year, Claire is plagued by frequent infections, which appear to be linked in some way to the birthmark on the left side of her face.
We would first notice the change in behavior with Claire, that she became moody and cranky. And then we would notice that the birthmark would become more pronounced or visible. And then there would be sometimes a slight swelling that would occur, and then the pain would follow shortly after.
The Manties grow increasingly concerned and puzzled, but while the doctors assure them that there's nothing serious to worry about, the pain and swelling begin to spread across Claire's face.
As she's getting older, she's able to let us know that she's still having pain episodes, and pointing to her jaw and just in general the left side of her face, not particularly her ears.
She'd scream and yell and wail until somebody, would hold her, rock her, pick her up.
The doctors were telling us that she was just a very sensitive kid, that she was dramatic. The doctors were thinking that maybe she was getting social enjoyment out of the doctor visits. Ryan and I knew that there was underlying pain issues.
Sometimes I thought that I would just have this pain forever and would never go away.
I felt helpless. My friends didn't have the same problems with their kids. I was concerned that there might be something else going on.
Then, shortly after Claire turns 5 years old, she takes a sudden turn for the worse.
My temperature kept getting higher. My face got swollen.
It looked like she had stuffed her left cheek with marshmallows, but it was a little bit lower on the face. It was down in the neck area. She was being totally nonsensical. She didn't know where she was. She didn't know who I was.
I think a little bit of my wife died that day.
Since the day she was born, 5-year-old Claire Mantie has been suffering from bizarre episodes of facial pain that seem to coincide with the birthmark on the left side of her face suddenly changing color.
She would put her face up against your body and rub on it to try and soothe herself.
But now, Claire is sicker than ever before. She's spiking a fever, and her face is severely swollen.
She had a fever of about 104, was completely lethargic and limp, so we rushed her into the ER.
My ears felt like someone was sticking a Q-tip in and was just not letting it out. They were just touching my eardrum and pounding, and I could hear pounding in my ear. This was not normal. I never felt this before.
Alarmed, the medical team immediately administers a blood test.
Her white blood cell count was completely elevated, near 3 times what it should have been, and that it indicated there was some sort of major infection going on. It looked pretty obvious to be the left side of the face. They initially put her on some medication to help retain fluids because she was very dehydrated, and that's where the disorientation was coming from. And they gave her antibiotic shots every 4 hours.
Over the next few days, Claire's infection is gradually brought under control, but her face remains extremely swollen. The doctors now suspect that the inflammation near her jaw may be the result of a blocked saliva gland and order a CAT scan to find out for sure.
Waiting for the results was excruciating. We weren't sure what was going on.
Later that day, the findings come in, and the report sends Beth and Ryan reeling.
One side of the face, right down the middle, was absolutely fine and normal, and the other side looked like Swiss cheese.
Based on these images, the doctor concludes that Claire is suffering from fibrous dysplasia, a rare disease in which bone thins out and is replaced by fibrous tissue.
The doctor said there was no treatment. He basically said that it's something you're just gonna have to live with.
So far, the disease has just affected Claire's jaw. But because fibrous dysplasia weakens bones, they are more susceptible to fracture over time. She won't be able to play any sports and will have to be monitored carefully for the rest of her life.
There was going to probably be some deformity in the bones that were affected. My main concern was what was going to happen to Claire's face as she hit puberty, the time when fibrous dysplasia really grows.
But while the fibrous dysplasia explains the facial pain that Claire's been suffering from for years, it doesn't account for the unusual birthmark or the frequent infections she's so susceptible to.
He told me that it just happened to be a coincidence that we found the fibrous dysplasia because of this unknown infection.
At this point, my wife is nuts. She can't even believe that this is all they're giving us.
It didn't make any sense to me that she had swelling in the exact same spot, that the bones were affected with this fibrous dysplasia. We had also noticed that Claire would periodically complain of random pains in her legs and her hips.
Determined to get to the bottom of things, Beth takes Claire to a new doctor in December of 2005. He gives the little girl a thorough exam and reviews her history, including the previous CAT scans of her jaw.
The doctor ordered a full body x-ray at that point and to find out where else she may have bone involvement.
The new films reveal that the fibrous dysplasia is beginning to erode other bones in Claire's body, her forearm, hip bone, several ribs, and the top vertebra of her neck.
Ryan and I were concerned. It was very scary.
These findings, coupled with Claire's strange birthmark, are important clues for the doctor. He believes that she's suffering from McCune-Albright syndrome, a rare genetic disease that often sets in during childhood.
Fibrous dysplasia was one of the symptoms of McCune-Albright syndrome, along with having a birthmark near her jaw where we know she has the bone involvement. At this point, I'm excited that we finally have a diagnosis that seems to fit closer to what we've had experienced with Claire.
But the diagnosis is bittersweet. There's no cure for McCune-Albright. And in addition to bone degeneration, Claire will have to be monitored for possible cardiac complications associated with the condition.
I remember just thinking about Claire and thinking about our future and her future and not really knowing what was going to happen next.
For the next year and a half, the family focuses on managing Claire's frequent infections and chronic pain.
Claire was in so much pain that she could do nothing but scream at the top of her lungs. The pain episodes would last anywhere from a couple of hours to a couple of days. At this point, we'd make an appointment at a pain clinic to help Claire better control her pain during these episodes. They did prescribe a narcotic for her to take when the pain was uncontrollable or not treated with over-the-counter drugs.
Desperate for help, the Mantis attend a conference on rare disorders in August of 2007. At the event, Beth asks a McCune-Albright specialist to take a look at Claire. But what he tells the Mantis turns their world upside down.
The doctor examined her birthmark and stated that it was the wrong color, that typical birthmarks are coffee in color.
Claire's birthmark is a port wine color, while McCune-Albright birthmarks tend to be more light brown in appearance.
The doctor told us he didn't think Claire had McCune-Albright. I had no idea what we were going to find out.
The toughest part at this point was realizing that we may be dealing with something that is life-threatening.
Since she was a baby, 9-year-old Claire Matty has been suffering from severe facial pain, the result of what doctors believe is McCune-Albright syndrome, an extremely rare genetic disease that's slowly dissolving the bones in her body, especially in her jaw. But now one doctor is sure that Claire doesn't have the debilitating disease. It's a curveball that neither of her parents was expecting.
Beth and I were not sure now where to go at all because we were completely lost at this point.
The doctor immediately refers the Mattys to the Birthmarks and Vascular Anomalies Clinic at Children's Hospital of Wisconsin. In February of 2008, the family meets with a team of specialists led by Dr. Beth Drolet.
We knew a lot about Claire because we had volumes of her medical records. We had looked at her CT, and we had looked at all her imaging.
After performing a thorough head-to-toe exam, Dr. Drolet and her colleague, Dr. Michael Kelly, focus on the spot the pain seems to be emanating from, Claire's jaw.
Normal bone is usually very hard and non-tender when you feel it. Claire's bones were a little softer. The recommendation of the group was to biopsy both the jaw and the forearm. We wanted 2 different biopsies to maximize the likelihood of obtaining the correct diagnosis during one operating room visit.
We were nervous about doing the biopsy on her jaw because there was so much destruction of her bone. Even on the CT, it just almost looked like paper.
But the surgeon is confident he can get Claire through the procedure safely. And 4 days later, she's wheeled into the OR.
My worst fear was that we were going to lose her, or something medical related was going to stand in her way of becoming what she wanted to become.
An hour later, the medical team pronounces the procedure a success.
After the procedure's done, the specimens are sent to the lab, and the pathologist will take small pieces of the bone and slice them very thin and look under the microscope.
But when the findings come in, they're nothing short of shocking.
The bone from her jaw had several holes in it, kind of punched out holes, and the pathologist likened it to if you take a candy cane or a piece of candy that you suck on, there's these little holes throughout the area. Based on the pathology results and collectively as a group, our diagnosis was lymphangiomatosis.
Lymphangiomatosis is a rare and complex disorder of the lymphatic system. In healthy patients, fluid containing white blood cells moves through the body in lymphatic vessels and attacks infections. But in patients like Claire, the lymphatic vessels don't work properly. They grow uncontrollably and in parts of the body where they're not supposed to be. As a result, research suggests they can destroy healthy tissue, organs, or bones and disrupt immune function. The cause is unknown, and to date, there is no cure.
Lymphangiomatosis is a disease in which different areas of the body can be affected by abnormal collections of lymphatic vessels.
Claire's disease is in her bones. What we think happens in kids that have lymphangiomatosis is that during development, there was some kind of disruption as the lymphatic vessels were forming. So they have too many, and they're too big, and they're dilated, and they don't work properly.
Although we think of bone as permanent and static, in fact, bone is continually replenishing itself, dissolving and then reforming. In a healthy individual, there's a balance between the cells that make bone and the cells that destroy bone. But in patients with lymphangiomatosis, the presence of abnormal lymphatic vessels overstimulates the destructive bone cells. As a result, the balance tips in favor of bone destruction.
Her jawbone is probably 10 to 20 times thinner than it should be.
But while Claire's jaw is the most affected, other bones in her body have also been ravaged by the disease.
She has lymphatic destruction of her left mandible, the base of her skull, which is kind of back here, the bones of her skull, She has it in her right arm, she has it in her pelvis, she has it in many areas within her spine. She has a few lesions in her rib as well.
With a diagnosis in hand, all of Claire's puzzling symptoms now make sense. Dr. Drolet explains that the disease revealed itself as soon as Claire was born, in the birthmark on the left side of her face.
The birthmark is from abnormal or excessive lymphatic vessels that are within the very, very superficial layers of the skin. Typically, if there is an infection in and around an area where you have abnormal lymphatic vessels, the lymphatic vessels will dilate, they get swollen and inflamed and red. And if the lymphatic vessels are in the surface of the skin, as they would be in a birthmark, you can actually see them swelling, they turn bright red.
Lymphatic vessels are supposed to fight off infections by transporting lymphocytes, or white blood cells, to the source of the infection. But in Claire's case, the infection-fighting process is disturbed.
Because of the abnormal lymphatic vessels, we can assume that she probably was much, much more susceptible to infections.
The infections, in turn, caused her lymphatic vessels to become inflamed, which ultimately led to the swelling in her face.
When the lymphatic vessels are deeper underneath the skin, the fluid kind of builds up in those vessels and causes swelling.
The chronic pain was a direct result of the unique manner in which her lymphatic vessels affected her bones.
Bones grow in response to pressure, and so the vessels actually cause increased pressure kind of from the inside out, and that's actually one of the things that we think might be causing some of the early symptoms of pain.
Although the diagnosis helps explain Claire's mysterious medical history, nothing could have prepared the Mantis for what the medical team says next.
Most of the complications come from in and around the ribs, and the ribs can break. But also the lymphatic vessels can expand into the tissue surrounding the lungs, and the lymphatic vessels contain a lot of fluid, and that fluid begins to leak in and around the lining of the lungs and can collapse the lungs.
One part of me felt relief that we finally knew what it was. The other part of me was absolutely terrified.
Progression of disease can occur over years or decades, resulting in fragility of the bone or fracture of the bones. Or it can be very sudden, where patients can die.
After suffering from inexplicable and often harrowing facial pain since birth, 10-year-old Claire Manti has just been diagnosed with lymphangiomatosis, a rare and potentially life-threatening disease in which the body destroys its own bones.
Ryan and I were really overwhelmed with what we had been told.
My parents told me it can spread, it can go to my lungs, and that's what can cause you even to die. And I got really scared.
It is almost impossible for us as physicians to be able to predict her prognosis. It's very rare, maybe less than 200 cases reported, and really are just beginning to understand what happens to these kids over time.
And although researchers are busy working on new treatments, their side effects remain unknown.
Currently, there is a new clinical protocol that is being developed using experimental agents to treat patients with abnormal lymphatic growth such as lymphangiomatosis. We will recommend Claire for this clinical trial.
In the meantime, the best the medical team can do is work to manage Claire's pain and keep infections to a minimum.
We are aggressively treating any pain with antibiotics in hopes of decreasing the aggressiveness and the swelling of the lymphatic vessels with infection.
The doctors will also need to regularly monitor Claire's fragile bones with x-rays and CAT scans.
We want to get an idea of how fast Claire's bone destruction is progressing. Is it stable or is it getting worse?
Although the Mantis are relieved that Claire's finally in good hands, they can't help but wonder why it's taken so many years to get a solid diagnosis.
Claire was initially diagnosed with McCune-Albright syndrome as well as fibrous dysplasia of the bones. Both of these are rare problems, and one can be associated with the other. However, Claire's findings on x-ray were really inconsistent with this particular problem.
The symptoms are so vague, you know, pain, headache, ear infection. A lot of kids have tons of ear infections. All you can see on the x-ray or on a CT is that the bone is just disappearing, but you don't really know the process. So it often takes years before these kids are diagnosed.
As a dad, you have dreams of what your kids are going to do and what they're going to be, but it hurts not knowing what she's going to have to deal with growing up and going forward in life.
Today, 9 months after being diagnosed, Claire is doing well and is determined to live a full and active life, at home and on the stage.
I like to sing and act. I've been in 2 plays.
Time with Claire now is more precious than ever.
They've told me that it's going to be there forever and that it could get worse and it could just stay as it is right now. All we have to do is just pray and hope that it'll get better.
While Claire Manty's symptoms surfaced the day she was born, Sue Ingraham was well into her 30s when a mysterious condition began to gradually take over her body. In 1989, 34-year-old Sue Ingraham was living a seemingly perfect life in Northern California with her husband and 2 young children. Over the years, she'd become adept at juggling a very busy schedule, taking care of her family, teaching at a local elementary school, and making time to stay fit.
I ran 5 to 6 days a week. I eventually worked up to 4 miles a day.
Every morning, she would get up at 4 or 5 and she would go run.
But one day in the fall of that year, after returning from her daily run, she notices a strange sensation in her left foot.
The pain was like I was walking on a marble.
An experienced runner, Sue is no stranger to aches and pains. But she's never felt anything like this. Hoping for some relief, she replaces her sneakers with a new, more heavily padded pair.
If I didn't have some kind of a cushion on the ball of my foot, I could feel that marble-type feeling.
But over the next few weeks, the strange pain becomes nearly unbearable.
I stopped running and I switched to riding my stationary bike. And so I would get on my bike and ride for about 45 minutes.
Then, a few weeks later, when she least expects it, Sue's blindsided by an entirely new problem.
All of a sudden, my knee just froze up. And when I got off of my bike, I noticed that I couldn't bend my knee. The pain was too intense to even try. And my hip was having a lot of pain, a lot of pressure. After a few weeks of dealing with all these different symptoms, I made an appointment with a local orthopedist, and I explained my exercise routine.
The doctor listens carefully and performs a complete physical, but it doesn't take long for him to reach a diagnosis. The years of running have finally caught up with Sue. She has bursitis.
They explained that bursitis is kind of an inflammation in the joint area, and he thought I had bursitis in my hip, and I was just having some arch problems from the running.
The doctor prescribes a high dose of ibuprofen to alleviate the inflammation and recommends physical therapy. He assures Sue that her symptoms will go away in a matter of weeks. But they don't.
I tried everything they gave me. I went to see the physical therapist. The ibuprofen would take the edge off, but nothing really seemed to make things better.
Sue does her best to manage the pain and adjust to her new physical limitations. Then, in the winter of 1992, life offers up a challenge of a different sort.
My husband was offered a job in Washington State, and so We moved to Kennewick.
Sue begins working as a teacher's aide at a local school and quickly makes friends with a neighbor, Nanette Olson.
She had a couple little girls, and we became friends. We just happened to like each other's company.
We walked every day, usually 5 to 6 days a week. Pain wasn't too bad. But as time went on, the pain started becoming more intense.
I would look at her, and you could tell that something was wrong.
I always felt like there was something growing in there, like somebody was slowly inflating a balloon.
Seriously concerned, Sue makes an appointment with her family physician. And after performing a careful examination, he offers her a diagnosis that takes her by surprise.
He basically told me that I was getting old, even though I was only in my 30s at the time.
She was way too young for him to make a comment that her pain was due to aging. Besides that, a lot of her symptoms started years before.
I kind of felt that was ludicrous because I was in good shape. To me, I felt I was too young to be experiencing old age symptoms.
Sue leaves the doctor's office convinced that she has little choice but to simply grin and bear it.
My family knew about the pain, but I really didn't make too big a deal out of it. I just didn't want to worry them. There wasn't a whole lot they could do, so I didn't share with them too much about it.
But over the next 12 months, Sue continues to deteriorate to the point where she can no longer perform basic movements.
I had to kind of sit down very gingerly because otherwise I would literally jump out of my skin because it would send kind of shock waves through my body. When you live it every day, pretty soon you just learn to deal with it. I still had a job to go to. I still had children to raise, a husband, a house to take care of. I didn't want it to win.
But as the years go by, the pain grows sharper, more excruciating, and ever more present.
I would wake up sometimes every hour, sometimes every couple hours. It was constant tossing and turning.
She couldn't seem to get away from the pain.
I just had a lot of very intense pain in my hip. Life as I knew it was changing.
For the last 13 years, Sue Ingraham has been suffering from a mysterious, agonizing pain in her hip and leg. But doctors have told her it's the result of bursitis, or possibly advancing age.
This orthopedist suggested that I keep taking the ibuprofen as needed and told me really, at this point in time, there was nothing that could be done.
It was really difficult to sort of grasp the idea that she was, hurting for so long.
By the fall of 2002, the pain has begun to affect her work, and Sue's forced to make an extremely difficult decision.
I had switched from working with children into the administration in the secretarial field because my left leg would not bend enough in order for me to sit cross-legged like we have the children sit.
While her new job takes some of the pressure off her leg, one day in the fall of 2003, after moving some boxes, an alarming new symptom strikes.
I had an excruciating pain for the very first time in the groin area. I couldn't even touch that area. I mean, it was so tender. I made an appointment with our new family physician, and he wanted to do a CT scan, so he scheduled that right away. I could tell he was determined to come up with an answer for why I was feeling the pain that I was in. It was a wonderful relief to have somebody finally take me seriously.
The doctor is confident that Sue has a hernia, but they'll need the CAT scan findings to confirm his diagnosis.
I got a call in the evening about 7 o'clock, and I remember seeing the doctor's name on the caller ID. And I knew if he was calling me at night that something serious was going on. He proceeded to explain that I had what they suspected was a very large tumor down in the sciatic notch. I don't really remember much about the conversation after that point because I think at that point I was kind of in shock. I knew having a large tumor was not a good thing, and so I didn't know what the future was going to hold.
Suddenly, the clock is ticking. It's imperative that they determine if the tumor is benign or malignant right away. So the doctor refers Sue to an orthopedic tumor specialist at the University of Washington in Seattle, Dr. Ernest Conrad.
She sent me records to review prior to her clinic appointment. When they did the initial CAT scan of the pelvis, they could see a soft tissue tumor in the left pelvis near her hip joint.
It was kind of bittersweet because I knew all this time that there was something really wrong with me, so I felt validated, but also really scared.
Dr. Conrad explains that he'll need to biopsy the tumor to find out exactly what they're dealing with. But the biopsy isn't going to be easy. Because the tumor has grown into the nerves in her hip, the extensive surgical procedure could leave Sue's left leg paralyzed.
There was at least a 50% chance that she would lose the main nerve to that leg and most of the function in the lower part of that leg from that tumor associated with her nerve.
I was pretty devastated. I was trying to get myself mentally prepared, trying to think about what I needed to do in case the outcome wasn't good. At that point in time, I decided not to tell my children. My youngest was in college. I didn't want to worry her. I wanted her focusing on her studies. And my oldest just would have been intensely worried, so I just didn't want to tell him anything.
I had no idea that any of that was going on while I was in school. She's always been very quiet about it.
I was really concerned. She was my best friend. We were together every single day.
A few weeks later, Sue makes the 220-mile trip from Kennewick, Washington to Seattle for the surgery. It's a day she'll never forget.
I remember being wheeled in. I remember thinking that life as I knew it might very well change that day. And then I think at that point, I just chose to tune it all out. And I don't remember much after that.
48-year-old Sue Ingraham has just been wheeled into the operating room. Surgeons have located a large tumor growing on the nerve that controls her leg, and they're about to perform a biopsy to find out if it's cancerous. It's a grueling 3-hour procedure that could leave Sue paralyzed.
I just didn't know how I was going to deal with all of this.
In the OR, Dr. Conrad carefully extracts the entire tumor and then sends the tissue sample to the lab for testing. Within the hour, the pathology results are in.
We were fairly confident it was a benign or low-grade tumor under the microscope. She's really fortunate that she had a less active tumor. If she'd had a malignant tumor, that tumor would have grown and metastasized within a year, and she wouldn't have survived.
Not only is Sue lucky the tumor is benign, she's extremely fortunate Dr. Conrad found the tumor when he did. Had it remained undiagnosed, Sue would most likely have suffered permanent nerve damage and possibly lost the use of her left leg.
I knew I was one of the lucky ones because I now knew that I was going to live. I knew I was going to make the best of whatever outcome I had.
Based on the results of Sue's initial biopsy, we made a diagnosis of neurofibroma.
Neurofibromas are rare, benign, slow-growing tumors that can grow out of the cells that surround a nerve. In a healthy individual, the nerve distributes sensations and impulses throughout the body. But in patients like Sue, the neurofibroma compresses the nerve, triggering severe pain and weakness. The cause is unknown.
A neurofibroma is typically a solitary tumor associated with a nerve. They all have benign and malignant variants. Most of the time, they are benign tumors that do not act badly, and they do not metastasize, and their recurrence rate is pretty unusual.
I knew all this time that there was something really wrong with me.
Suddenly, all the mysterious pain Sue has been enduring for the past 13 years makes sense.
Sue presented with some diffuse pain around her pelvis, pain in her foot, pain in her knee, pain in her hip. I don't think there's any doubt that this particular tumor was causing all of those pains because of its direct compression and pressure on the sciatic nerve, the major nerve that's deep in the middle of your pelvis. It innervates almost all the muscles and contributes almost all the function below the level of your knee.
For the first time in more than 2 decades, Sue can imagine a life without pain. But now, she can't help but wonder why it took so long to put the seemingly simple pieces of the puzzle together.
Most doctors haven't seen a nerve tumor of the sciatic nerve and don't even think of the sciatic nerve in between the back and the knee. They'll think of a tumor in the knee, they'll think of a herniated disc, but they won't think of a tumor in the pelvis or near the hip joint. Making that connection is pretty challenging.
10 days after surgery to remove the growth, Sue is on the road to recovery.
It felt great. It just felt so good to be able to be up on 2 feet, see that they were both working, and knowing that everything was going to be good from there on.
Sue's follow-up involves multiple MRIs. We've done that for 4 years now, and we'll probably back off now and follow her every 2 or 3 years. Just as long as she doesn't have any increased pain, she's probably fine.
For the first time in so many years, I could do anything. I just didn't get tired like I used to. I didn't have pain. I felt like Dr. Conrad had given me my life back.
Today, Sue is back to being her old active self. She's working full-time and enjoying all the physical activities she was unable to do for years.
I can ride a bike, I can do yoga, I can do anything that requires strength in that left leg that before I couldn't do.
It's definitely made me look at my mom in a different way because, I grew up with her always being in pain and never realizing what she was going through. I think being able to identify with that kind of perseverance has really shaped who I am.
One of the wonderful things that I have in my life again is enjoying the outdoor life without any limitations. I would suggest to anybody who's experiencing chronic pain to just keep pursuing different doctors until you find somebody who takes your pain seriously. And you have to be your own advocate.